What if the drink sitting in your fridge right now could do more for your blood pressure than the walk you took this morning? I'm Dr. Ethan Cole. I'm a cardiologist. I've spent the last 15 years in my Denver practice treating patients over 60, and I want to tell you something most doctors never bring up in a 12-minute appointment. What you drink in the 2 hours before bed can move your blood pressure numbers almost as much as what you eat all day. Here's a number to sit with for a second. In one clinical trial, older adults who added a specific evening drink to their routine saw blood pressure drops comparable to what you'd expect from an actual medication. No new prescription, no side effects, just timing and the right glass. I'm going to walk you through 3 drinks, ranked from good to the one I actually recommend most to my own patients. Stick with me through all 3, because the order matters. And the last one is the one most people have never even heard of. But before we go further, if you've ever been told your blood pressure runs a little high and you just nodded and moved on, this video is for you. If you think this could help someone, hit subscribe right now and share this with someone you really care about. A parent, a spouse, a friend who's been handed that same warning at their last checkup. Number 3 on the list, hibiscus tea. Now, hibiscus isn't some fringe wellness trend. It works through a mechanism your body already understands. It gently relaxes and widens the blood vessels, similar in principle to how certain blood pressure medications work, just milder. A study funded through the USDA and published in the Journal of Nutrition put this to the test in 65 adults with elevated blood pressure. The group drinking 3 cups of hibiscus tea daily saw their systolic number, that's the top number, drop by over 7 points in 6 weeks. 7 points. That's not nothing. Let me tell you about a patient I'll call Robert, 68, a retired mail carrier. He used to have a cup of coffee before bed out of habit, not even because he wanted it. I had him swap that for a cup of hibiscus tea instead. Nothing else changed. 3 months later, his home readings were consistently lower, and he told me, I didn't think a tea bag could do anything. Turns out I was wrong. That's the part almost nobody talks about. Sometimes the fix isn't adding something new. It's just switching what you're already reaching for. One caution here. Hibiscus can interact with certain blood pressure medications, so if you're on one, run this by your doctor first, not next week, before your next cup. Number 2, beetroot juice. This one is backed by newer research, and it's specifically interesting for people over 60. Researchers at the University of Exeter found that when older adults drank a concentrated beetroot juice shot twice a day for 2 weeks, their blood pressure came down. And here's the surprising part. The same effect didn't happen in younger adults at all. Something changes in how your body processes it as you age, and it works in your favor. Here's why. Beetroot is loaded with natural nitrates. Your body converts those into nitric oxide, which is the compound that tells your blood vessels to relax and open up. Think of your blood vessels like a garden hose. Nitric oxide is what loosens the kink in that hose so blood can flow freely instead of forcing itself through a narrow space. Picture Diane, 71, a retired school teacher who'd been dealing with borderline high readings for years. She started with just 2 ounces of beetroot juice in the early evening. She told me she noticed her ankles felt less swollen within the first week. A small thing, but it kept her motivated. This pairs powerfully with what we just covered, because both work on the same blood vessel pathway from 2 different angles. Now, the one I recommend most. Number 1, tart Montmorency cherry juice, in the evening, close to bedtime. Here's the part that makes this the standout. Researchers at Northumbria University found that tart Montmorency cherry juice reduced blood pressure in men with early signs of hypertension by about 7%. And they noted that reduction was comparable to what you'd see from an actual blood pressure medication. Read that again. Comparable to medication. From a glass of juice. But it doesn't stop at blood pressure. This is the drink that does double duty. Tart cherry juice is naturally rich in melatonin, the hormone your body uses to regulate sleep. So while it's working on your blood vessels, it's also helping you fall asleep faster and stay asleep longer. And that matters more than people realize. Poor sleep itself drives blood pressure up. It's not bad luck. It's biology. You fix one, you help the other. Let me tell you about Margaret, 66, a retired dental hygienist who used to lie awake at 3 a.m. wondering why her numbers never seemed to budge no matter what she cut from her diet. I had her start with 4 ounces of tart cherry juice about an hour before bed. Within a few weeks, she wasn't just sleeping better. Her home blood pressure log showed her most consistent numbers in years. She told me, I finally feel like I'm working with my body instead of against it. One important note, Tart cherry juice can interact with blood thinners and some blood pressure medications, so check with your doctor or pharmacist before making it a nightly habit, especially if you're already being treated for hypertension. Quick gut check before we wrap up. Drop your age in the comments and tell me which of these 3 you're going to try tonight. So let's bring it all together. Number 3. Hibiscus tea, gentle and well-studied. Number 2. Beetroot juice, uniquely effective for adults over 60. Number 1. Tart Montmorency cherry juice before bed. The only one on this list doing double duty on both your blood pressure and your sleep. Your body isn't broken, and your numbers aren't fixed in stone. Small, consistent choices. Like what's in the glass next to your bed tonight. Genuinely move the needle. If this helped you see your evening routine differently, hit subscribe, share it with someone who needs to hear it, and I'll see you in the next one. Take care of that heart of yours. It's the only one you get. The right drink won't replace your medication, but it might just replace your midnight worry.